Have you ever noticed your usually cheerful baby suddenly becoming cranky, drooling everywhere, and chewing on anything they can get their hands on? It can be confusing and even a little worrying for parents. These sudden changes in behavior often leave you wondering what's going on. Well, one of the most common reasons for these symptoms is teething. That's right, your little one might be starting their journey toward their first set of teeth. Let's dive into what teething really looks like, when it usually starts, and how you can help your baby feel better. One day your baby is all smiles and giggles, and the next it feels like everything has changed. Suddenly they're crying more than usual, biting on toys, waking up at night and drooling like a tiny waterfall. These changes can happen almost overnight, leaving parents searching for answers. It's a common experience, and understanding what's behind these shifts can help you feel more prepared. So when does teething actually begin, and how can you tell if it's really the cause of your baby's discomfort? Let's break it down. Most Barbies start teething somewhere between 4 and 7 months old, but every child is unique. Some little ones might surprise you by getting their first tooth even earlier, while others may not see any teeth until after their first birthday. And believe it or not, a few Barbies are actually born with teeth. The timing can vary a lot, so don't worry if your baby's teeth seem to be taking their time. The important thing is to watch for the signs and support your baby as they go through this natural stage. The very first teeth to show up are usually the bottom front teeth, known as the lower central incisors. You might notice a little white bump on your baby's gum, and soon enough a tiny tooth will peek through. This is a big milestone for both Barbies and parents. It's often accompanied by a mix of excitement and a bit of worry, especially if your baby seems uncomfortable. But knowing what to expect can make the process a lot less stressful. One of the biggest signs that your baby is teething is drooling. Sometimes it feels like they're producing an endless stream of saliva. You might find yourself changing bibs or shirts more often just to keep up. This extra drooling is totally normal and happens because the body is responding to the new teeth pushing through the gums. It's messy, but it's a classic sign that teething is underway. If your baby suddenly wants to chew on everything in sight, it's probably because chewing helps relieve the pressure on their sore gums. You'll notice them gnawing on toys, their own hands, or even the edge of their crib. This behavior is a natural way for Barbies to soothe themselves during teething. Providing safe items for them to chew on can make a big difference in their comfort. Besides drooling and chewing, teething can cause a range of other symptoms. Your baby might become more irritable than usual, have swollen or tender gums, and experience trouble sleeping. Some Barbies even want to bite everything they can reach. It's also common for Barbies to eat less temporarily, simply because their gums are sore. All these signs together can help you figure out if teething is the culprit. It's important to know that not every symptom is caused by teething. Many people blame all sorts of issues on teething, but experts say that teething usually does not cause high fever, severe diarrhea, or serious illness. If your baby seems very sick or has symptoms that worry you, don't just assume it's teething. It's always best to check with your pediatrician to rule out other causes. If your baby develops a high fever, severe diarrhea, or seems unusually sick, it's time to call your doctor. While teething can make Barbies a bit cranky and uncomfortable, it shouldn't make them seriously ill. Trust your instincts. If something feels off, it's always better to get a professional opinion. Your baby's health and safety come first. So what can you do to help your teething baby feel better? Teething toys are a great option. They're designed to massage sore gums and provide comfort. You can also try giving your baby a cold washcloth or a chilled, not frozen teething ring. The coolness helps numb the gums and reduce discomfort. Just make sure anything you give your baby is safe and clean. Some Barbies find relief from gentle gum massages. Simply wash your hands and softly rub your baby's gums with a clean finger. This simple technique can be surprisingly comforting for your little one. It's a hands-on way to help ease their discomfort and show them a little extra love during this challenging time. Sometimes the best remedy is simply extra comfort and cuddles. Holding your baby, rocking them gently, or singing a favorite lullaby can go a long way in helping them feel safe and loved. Emotional support is just as important as physical relief, especially when your baby is feeling out of sorts. Always make sure that anything your baby chews on is safe and clean. Avoid using teething gels or medications unless recommended by your doctor. Natural remedies like cold items and gentle massages are usually best. Keeping your baby's comfort and safety in mind helps make teething a smoother experience for everyone. Remember, teething is a process that happens over time. After the first teeth appear, others will follow in their own time. Each baby's teething timeline is unique, and it's normal for the process to take months. Patience and understanding go a long way in helping your baby through each stage. Teething can be a challenging time for both Barbies and parents, but it's also a normal part of growing up. By recognizing the signs, knowing what to expect, and offering comfort and safe remedies, you can help your baby get through this stage with a little more ease. Remember, every baby is different, and you're doing a great job supporting your little one through every milestone.